Thank you for joining us on Watchdog this week on Mint Press. As always, we are going against the grain, covering stories which are neglected by the mainstream media. For that reason, I hope that you can support Mint Press by liking this video, subscribing, and also supporting us on Patreon. We are joined this week by the legendary GP campaigner, Bob Gill. How are you doing, Bob?
Very well, thank you. Thanks for inviting me along, Lowkey.
Thanks for joining us. And I just wanted to start with, what was your trajectory from GP, primary caregiver, to campaigner? How did that happen?
Well, I've always been sort of interested in politics, voted Labour all my life, family or working class. Second generation immigrant to this country. Parents came from India. And, very busy paying the mortgage, bringing up the kids. But something happened in 2012, which struck me as a point at which I needed to become more active. We'd already suffered the downgrading of a local hospital, Queen Mary's in Sidcup, and I'd started to experience difficulties getting my patients admitted, sick patients not getting admitted, sometimes being discharged home when they weren't ready, and occasionally worse off than when I sent them in. So we'd suffered a downgrading, and there was a threat to a neighbouring hospital down the road, Lewisham Hospital. Now, people might be aware that the Save Lewisham Hospital campaign was quite a big campaign, very popular, 2 very big marches. Now, that was my first time I was active in campaigning, and I learned a lot during that process. But what actually pushed me to act was a particular conversation with one of the GP leaders locally. And I asked him, I said, look, my patients aren't getting a good deal anymore. Some of them are getting very badly treated by our local hospitals. And, what are you going to do about it? And he said 3 things to me. First, he said, I'm just too sensitive. The second thing he said was, my patients are unlucky because he's not heard this from anybody else. And the final thing, the straw that broke the camel's back, he told me, don't worry about it, you're not paying for it. Now, I thought, if this is the response from a leader of GPs, then we haven't got a hope in hell's chance of pushing back against this. And, I took a look and I said, well, if nobody else is going to do something, maybe I should start doing something. And that was the point at which I became active. Yeah.
Wow. Well, it would be important for us to run through really how it was the National Health Service was founded. We know that post World War II, you had 30% of the homes destroyed or damaged in this country. Infant mortality was 10 times what it is today. And 20,000 people died in 1 year from tuberculosis. Despite that, Winston Churchill's Tory party voted 21 times against the establishment of the NHS. And it seems to have been a bitter battle. Could you tell us a bit about the foundation of the National Health Service?
Yeah, so during the war, the public got a taste of what it might be like to have, a collective approach to providing basic services. So a lot of the private hospitals and the charitable hospitals were put to public use. And there was a report commissioned during the war years by Beveridge, who suggested that a new way of running things for the country, for the benefit of the vast majority of the population, might be to establish a welfare state. And the NHS was a central pillar of the welfare state. But as you point out, it was not an easy birth. Aneurin Bevan, who is a very forceful character, grew up in Wales, experienced something equivalent to the NHS in the coal mining towns of South Wales, where they had a collective funding for health services for the coal miners and their families. And he wanted to extend that principle across the nation. But he met very many obstacles. You mentioned the Tory party, that was one element of it. But you also had the medical establishment. And then the BMA was the big voice against the National Health Service. The propaganda they were using was that it would just take away medical freedom, it would take away professionalism, and they generated a significant scare around the National Health Service. And most of the GPs who were actually the stumbling block voted against the establishment, but in the end, they were won over. And that was the right decision. And in the course of having the NHS, of course, most doctors who understand our health service compared to other health services appreciate what it delivers. The NHS we have now is so far removed from those first principles that even I cannot defend the level of service at the moment. We have historic waiting lists, we have poorer quality care. My fight is to return the NHS to its original founding principles, where money went on provision of care and wasn't sucked out by private corporations.
Right. I mean, the roots of where we are now were very much laid in the Thatcher years. And in fact, during Callaghan's government, Labour government, which eventually took a loan from the IMF, you had in 1977, the Conservative Party's Economic Reconstruction Group put around this idea of denationalization. And within these documents, they say that it shouldn't be a frontal attack. It should be a return to the private sector by stealth. And one of the ways they seek to do this is to establish separate profit centers. You also have, in the same year, the Centre for Policy Studies established by Keith Joseph. And you have John Redwood and Oliver Letwin put together this paper, Britain's Biggest Enterprise, Ideas for Radical Reform of the NHS. How did the Thatcher era lead us to where we are today?
Well, you're right. The accelerator, the turbocharge was put on privatisation under the Thatcher years. But in fact, the year of the NHS birth, 1948, there was a group set up to attack the NHS called the Fellowship for Freedom in Medicine, sponsored by the private insurance sector. But under the Thatcher years, they did start the assault on the NHS, but indirectly, by stealth. What they did to start off with was argue that services like catering, portering, and cleaning, they weren't really part of the NHS. And, if we gave it to the private sector, they'd be able to run it more efficiently, save money, and then would plow this money back into provision of care. Now, there wasn't much pushback against that. So that was in the early 80s. But we know years down the line that the standard of hospital food is atrocious. There has been endemic hospital-acquired infections due to superbugs like MRSA. A lot of that stems from the outsourcing of vital functions such as cleaning. But also what happened in the early 1980s was a report by Lord Griffiths. Lord Griffiths, formerly vice chair of Sainsbury's, produced a document which set out how to establish a business-friendly commercial culture within the NHS. And what that required was to replace the management. So you had a very streamlined, very efficient management structure in the NHS, predominantly led by doctors and nurses of experience who ran the show. But they were gradually pushed out of the way and replaced by an increasingly bloated corporate bureaucracy designed to disempower the professions, designed to push through market reforms, irrespective of the impact on patient care. Now, that was back in 1983. And then we went on to the creation of an internal market. Again, the same spin was put on this. By creating a market, you'd have competition. This would lead to a rise in standards and efficiency, more money to spend on the patient. But this is total nonsense. This is salesmanship. This is total flannel. What the creation of the market did, it created winners and losers. In terms of general practitioners, I'll give you an example. They created what's called fund holding, where they gave GPs control of their practice budgets. Now, the incentive for GPs to get involved was the money they didn't spend on patient care, they could take a slice of that action for themselves.
Wow.
So you started to introduce perverse incentives for the doctors to not necessarily act in the interest of the patient. What effect did it have on the hospital care? I was in hospital. I was a junior doctor in the early 90s, and we used to receive letters from GP practices, some of them with a big red stamp on them saying fund holding. We would have to prioritize those patients who came from fund holding practices. So you set up a two-tier system whereby fund holding GPs had greater incomes, fund holding their patients had better service, and you got this is divisive. This is against the principle of the NHS. Well, the other thing the market established was an expansion of the bureaucracy and more money going into running the bureaucracy. Now, by the mid-2000s, there was a study done by Professor Maynard, York University, I think 2006, where they estimated that the cost of running the NHS, you have essential administration, but by adding in the market, gone up from 4% to 14%. Now, that's 10% increase just gone in running the market. Now, in today's money, over the last 20 years, the NHS budget, let's round it down to biggest figures, 100 billion a year, 10% of 100 billion over 20 years. That is 200 billion pounds wasted on the market. This is not efficiency. The only thing it's efficient for is sucking money away from delivering care. That's the efficiency that they're after. So that was the early 2000s. Then you had the 2012 Health and Social Care Act, which was a major progression of the privatisation pushed through by the Tory Lib Dem coalition. And this forced out the competitive tendering of all hospital services. So now, no more were we operating a phony internal market. We were operating an explicit external market where private companies could bid for everything that the NHS provided. But I miss out a critical section there. Between 1997 and 2010, the Blair-Brown government did nothing to reverse the privatisation. They doubled down, they increased the bureaucracy, and in the early 2000s, for the first time in the history of the NHS, they outsourced clinical services. What I mean by that is routine operations. And what does the private sector do? They look for the most profitable activity. So they were given the easy operations in uncomplicated patients, and they were paid more for those operations than the NHS got. So you end up having, as I say, money drifting away from the NHS in fact ending up subsidizing the private sector to make a profit.
And also the PFIs specifically, what were those that the Blair and Brown regime introduced?
Yeah, so you referenced the 1977 restructuring document. If you think of the asset of the NHS in terms of how private capital see the NHS, they see it as a series of assets. You have the land and the buildings, you have the patient data, and you have the budgets. Now, PFI was a mechanism, a deliberate financial mechanism to grab hold of the land and the buildings. Now, this was sold as, a public-private partnership where the expertise of the private sector would deliver fantastic new hospitals on budget and on time. Again, total nonsense. We ended up borrowing £11 billion from private banks and financial institutions, and the public will have to pay back around £88 billion. So that's an eightfold increase over 30 to 50 years. Now, this is a stinker, at the end of which we won't own the hospitals. So you've had the NHS saddled with toxic debt that must be serviced over and above the provision of services, and debt that was scheduled to get more and more onerous as time went on. And this debt burden would be used as an excuse to sell off NHS land and property, whereby you paint a trust as a financial basket case and say, well, this trust is in debt now, so we have to merge it with the neighboring hospital and sell off the land. And that's what happened in my area. So there was PFI debt on the hospital in Woolwich, Queen Elizabeth's. They merged Queen Mary's in Sidcup with Queen Elizabeth's and the Prue, which had another private finance initiative debt on it. So you had two PFI hospitals who were bleeding money, and they merged with a totally publicly owned hospital with no debt on it, and they cannibalized that hospital, selling off half the land. So where there used to be a maternity unit, now there are luxury retirement flats. And all the pregnant mothers have to travel miles to deliver their babies.
So this is the
and they've gutted the managed decline and the financialization, the creation of a plausible narrative to justify the sale, the asset grab that's taking place.
Yeah. And in terms of the Health and Social Care Act, later on in 2012, establishing clinical commissioning groups. What do those clinical commissioning groups do?
Yeah, so these new structures did away with the old structures, did away with relatively functional, well-organized strategic health authorities, and broke up the NHS into over 200 clinical commissioning groups. And the excuse they used was we were giving power to the front line. Okay? The purpose behind that move was to disguise the breaking up of structures as an improvement, to hide behind this plausible narrative of doctors and nurses making decisions when they had no such role whatsoever. They were just really a rubber stamping organization. But it established a model of financing for the NHS based on insurance pools. So these clinical commissioning groups had their budgets devolved to them. They had a level of autonomy, and they could decide which services to fund. So they were used as a mechanism to shut down hospital services. So I was part of Bexley Clinical Commissioning Group, and every year they were told they had to save money because of PFI and whatever. How do you save money in medicine? Well, you stop providing services. So the clinical commissioning groups became a mechanism, became an axe to chop hospital services and provide a fig leaf of clinical medical input.
And then we have 2014, the US accountable care model. What does that mean?
Yeah, so there've been various policy papers that have come out of think tanks like the King's Fund and the Nuffield Trust, who label themselves as independent but get a significant amount of funding from government and NHS trusts. And they have been propagandizing for this transition to what's called the Kaiser model. Now, Kaiser Permanente is an American organization who developed a model of medicine, previously known as health maintenance organizations. The names keep changing, but the principles are the same. You mentioned accountable care, and the latest incarnation is in integrated care. But if we group all those names together and call it managed care, now what managed care does, it grabs control of public budgets and it sets up the system in such a way that profit is maximized by not spending money. How do we not spend money? We deny care to patients. That is the accountable care, managed care model. And that is what is being imposed on the NHS. But they couldn't do it in one step. They have to do it in a roundabout way. So creating clinical commissioning groups was a transitional step. And now we're having the merger of clinical commissioning groups into these new organizations. So if you did it in one go, people might notice the difference. But now it's been normalized to have these, local bureaucracies that were making decisions. We've almost become conditioned to accepting that services must be cut. But nobody's asking the question, where is the money going? And as I say, the money is not going on patients. The money is going on servicing PFI, the cost of running the market, the cost of all these managers, and increasingly the cost of failure.
And during this period, this attritional war against public health, essentially, what fate has befallen whistleblowers within the NHS?
Yeah, well, I've been in a position where I've met quite a few whistleblowers. Dr. Chris Day, he's a doctor who actually worked quite close geographically to me. Dr. Kim Holt, the pediatrician who raised concerns about baby P. Professor Edwin Jesudason, who was a pediatric cardiac surgeon, very eminent person. Now, these are three whistleblowers who had their careers destroyed. For what reason? They raised concerns around patient safety. Now, why does this need to happen? Because we're on a trajectory to replicate a dystopian and unsafe system, the American system. Highly profitable, but dangerous for patients and dangerous for staff. Now, in order to get there successfully from the government's point of view, they need to shut down dissent and they need to shut up whistleblowers. Now, not only do you get rid of the whistleblower, you send a very powerful institutional signal. Do not raise your head above the parapet because you will suffer the same fate. So you end up with a chilling effect on institutions whereby, we're constantly gaslighted about patient safety. The reality is the system is set up to make everything less safe.
In your estimation, how common are gagging orders that we hear of?
There has been some work done on this. I think Private Eye reported on this. We're talking about millions of pounds a year spent on making sure that whistleblowers go away. Very often they may sign a non-disclosure act and take a financial payment, but what they don't realize at the time is their career is over. They effectively become blacklisted. So that money doesn't go very far. They've ended up having to be a party to a cover-up very often. They've had to leave a situation where potentially there are system failings that continue to damage patients. So they have to live with their conscience. And very often they end up without a career as a result of it.
In terms of the passage that Britain is on towards the US medical system, in your film, the NHS, the Great Heist of the NHS, which I recommend everybody watch, you break down really the four columns of the US medical complex, from insurance companies, the hospital chains, the drug and medical companies, and to the US government. If you could give us a quick rundown of how that US medical complex looks.
Yeah, so the US has the most privatized system in the developed world. They spend per head of population more than double we spend in this country. Their taxpayers pay more than we pay for the NHS, and another whole load on top of that, more than 100% more on top of that through the privatized insurance-based system. Now, insurers do not want to cover people who don't have money and people who are sick, because sick people are expensive and you can't make profit out of them. And poor people don't have the money to pay your premiums. So the very people who need health services most are avoided by the insurance companies. You couldn't make it up. They have a health system designed to avoid sick people. Now, where do these sick people go? If they're elderly, they get state-funded what's called Medicare. And if they're children and very, very poor, they get Medicaid. So you have state funding for those groups, and you have private insurance for people, generally speaking, who have a job. And then you have around 30 million Americans with no insurance. So when they become ill, they have to pay out of pocket. They have no cover either from the state or from private insurance. Now, during the pandemic, there were a lot of people losing their jobs. And what went as well was their private health insurance. So at the very time they might need healthcare, they lost finances and they lost health coverage. It's a disastrous system. What you call market failure. The state has to step in where the market isn't interested. And that's the system where we are copying. So what will end up happening in this country is the NHS becomes the equivalent of Medicare and Medicaid. And gradually, it will no longer be universal and comprehensive. The range of services will diminish and diminish. More and more stories will come out about NHS failures. And the middle class will say, hang on, this is not very good. I don't feel secure. Guess what? I'll take out private insurance for myself and my family. So you have a middle class drift away from the NHS, and you will have the NHS providing really skid row services. And if you can't afford to opt out and buy insurance, then you risk either paying out of pocket or you just do without treatment. But the one thing that people need to get in their heads is the victims of all of this aren't just the poor. The real targets of this reform are the middle class, the people with money, the people who are working, because the insurance companies want their premiums. The only time they're going to find out how good their insurance is when they become expensive and ill. And then they'll find out the insurance will look for any reason to drop them from cover. And then they potentially face financial destruction, obviously ill health if they can't afford to buy the healthcare. The biggest cause of household bankruptcy in the States is through medical bills. Now, what most people don't realize is the vast majority of those people going bankrupt had medical insurance. Let me repeat, they had insurance that didn't protect them when they needed it. What sort of a system is this? It's just a mechanism for large corporations to fleece the taxpayer and to fleece the individual, only to dump them at the hour of greatest need.
I think what we see when we look at this picture is one in which, one of the many ways in which neoliberalism kills people. Could you break down for us your definition of neoliberalism?
Yeah, I'll keep it relatively simple. Low taxation, so the rich keep more of their money. Deregulation, so those laws that are in place to protect the public interest on safety, on people being qualified to do certain procedures, those protections are removed. Those are the main elements, really. Low taxation, deregulation, and privatization. Anything that can generate an income, any activity that can generate a profit is handed over to the private sector. And that's what's happened in this country. So we've more or less given away our utilities. The natural resources are handed over to private capital. The ones that don't make a profit naturally, like the railways, we subsidize the profit. And we're we're in the home straight of handing over the NHS budgets to private corporations.
At the outset of the pandemic, we saw Boris Johnson, Matt Hancock, and others within this government who certainly, regarding the policy around care homes, had what was an almost eugenicist type of policy, moving the virus into care homes for the most vulnerable in the society to really be most at risk. They initiated this clap for carers ceremony, weekly ceremony. What do you make of Boris Johnson and his clap for carers?
I think this is cynical optics and nothing more. If people have understood anything I've said so far, it totally is out of keeping, showing any appreciation for the staff, given what they have planned for the staff. We've had a decade's worth of austerity, where NHS staff have lost around 20% of their income in real terms. They are working in horrendous circumstances in overstretched hospitals. There are thousands of vacancies. I believe it was 40,000 nurse vacancies, 10,000 doctor vacancies before the pandemic. The government chose to ignore their own pandemic preparedness exercise, which said we didn't have enough PPE stockpile, we didn't have enough intensive care beds, we didn't have enough staff, we didn't have enough ventilators. They made a decision to ignore those warnings. So what that means is they made a decision to allow the pandemic to wreak havoc. Now, we know their decision was herd immunity at the beginning. They were expressing this quite clearly. I wrote an article in Consortium News with a colleague of mine, Dr. Sarah Ganguly, and we said, even an idiot in a binary decision has a 50% chance of guessing the right way. This government made a series of decisions which were all in the wrong direction if you believe saving human life is the outcome. But they made all the right decisions if you believe profiteering is the right outcome.
Wow.
So, even by somebody as respected as Sir David King, the former chief scientific officer, he estimated that due to the government's policies, lack of preparedness, the nursing home scandal, all of these factors have led to around 100,000 excess deaths because of policy decisions taken by this government. Now, if you add on top of that, a study produced by, I think it was Cambridge academics, looking at the impact of austerity on health and social care, that estimated 130,000 excess deaths over the decade of austerity. Now add those two numbers up. You're getting close to 250,000 people dying as a result of government policy in what we are led to believe is a liberal democracy. How can this be compatible?
And that's more people than are members of the Conservative Party. Do you also have a message for Richard Branson?
Well, Richard Branson is a recognizable figure. He's often painted as the smiling face of capitalism. He presents himself as a decent man pushing ahead with technology and all the rest. But when it comes to the NHS, he has a track record within the NHS. In fact, he's one of the few people via his company, Virgin Healthcare, that sued the NHS for not getting a contract. So they took the NHS to court at significant legal cost because they weren't awarded a contract. The contracts they do have, like every private company, they want to maximize profit. How do you maximize profit? By cutting corners, not providing care, and employing the cheapest staff. Now, there was a case report from a Virgin run urgent care center in Croydon, where the receptionists were in charge of deciding who needed urgent treatment. And as a result, an unfortunate receptionist decided somebody didn't look too unwell and she should wait. She ended up dying as a result of multi-organ failure. And this was reported in the press. So I would say to Virgin, get your hands off the NHS. I think, if we're going to do anything, if we want to scare off these corporate raiders, well, Virgin has quite a broad portfolio of commercial interests. Maybe we need to organize some sort of boycott of Virgin and scare him out of the NHS. Maybe that would be a good signal to other corporate raiders who are joining him.
I think also one of the things which is a shame is the extent to which people have not realized the relationship between the motherland, the home country, and the war on terror. If we look, for instance, at the company Khaki International, that half of the interrogators at Abu Ghraib in Iraq at the time of the torture scandal were working for, this was a company that within years of that scandal was given the contract for the census in Scotland. We also look at Lockheed Martin, responsible for the interrogators at Guantanamo Bay, and obviously the massive military industrial complex infrastructure that they're part of that was built up across the war on terror. They're stocks increased 1,200% in value throughout the war on terror. They got the contract for the census in Britain in 2010. Another aspect of the war on terror coming home could be seen to be the company Palantir, which was set up with CIA seed money that ran intelligence operations in both Iraq and Afghanistan, being given a contract to have our data through the NHS. I understand it's the subject of legal wrangling, but if you could just break down for us, who is Palantir and what is the status of their role within the NHS today?
Yes, so Palantir have been given contracts in America related to, I think, Homeland Security. I think they had contracts dealing with some of the immigration policies based at the border. They were also implicated in racially discriminatory IT systems. Now, for them to be given contracts within any public service, let alone the NHS, should raise significant concern. I believe Med Confidential and the legal firm Foxglove and Open Democracy have been pushing back against this particularly toxic involvement. And the last I heard is that Palantir have actually been pushed back, certainly when it comes to the NHS. But, you know, the corporations you mentioned, you know, they make money out of the destruction of lives. There's no other way of putting it. You know, the more people they can successfully bomb and kill in other countries, the greater the share price. Now, if you look at healthcare companies, if you look at drug companies, one company I want to mention here is Purdue Pharma. Purdue Pharma were the producers of OxyContin, a morphine-based painkiller, which they marketed as not addictive. Now, we know a decade down the line, with 500,000 people who have already died as a result of the opioid pandemic in America, that this company was willing to peddle these lies in terms of it not being addictive to maximize their profit. And, you know, one of the, despite them being implicated in all this mass death and destruction, 500,000 people at the end of a decade dying of opioid-related causes. A company called McKinsey, a management consultancy, went to Purdue Pharma and gave them advice on how to further maximize profit. Now, McKinsey should be ringing bells because McKinsey are all over the NHS. In fact, Dido Harding, who was appointed leader of the test and trace system, which she outsourced to Serco and Deloitte, she is a former McKinsey associate, as are several other leaders within the NHS. That is the background. So these totally amoral companies who are not interested in the impact on human life are all over the NHS. Other companies like United Health. United Health is a big insurer. They often pay out millions in settlement without accepting liability for fraud, for overcharging, for not paying doctors, for denying care to sick patients. These are the companies that we're bringing into the NHS.
And you've kind of touched on there this revolving door which exists. So on one hand, you have former Tory Health Minister Stephen Dorrell, now working for a company that profits from the privatisation of the NHS. Also, Simon Stevens going from United Health Group in the United States to head the NHS. If you could expand a bit more about this revolving door and why it is harmful to all of our health.
Yeah, so I would add to that list Patricia Hewitt, former Labour Health Secretary, Alan Milburn, former Labour Health Secretary, and Stephen Dorrell. All three of them are benefiting from the privatisation, which they oversaw whilst they were in office. So if while you're in office in public service, you can do a policy, and then within months of leaving your job, get a lucrative position in a company that benefited from your policy. Well, there's a word for that. The word is corruption. It's just that this country hasn't seen fit to label it as such and to legislate against it. But most people in the street would say this is corruption. So there are built-in massive conflicts of interest. Let's look at our recent Prime Minister, David Cameron, who was involved in a scandal with a finance company called Greensill. Now, he has made multiple millions of pounds, and one of his roles was to grant access to politicians. So they have an inside track into getting financial interests embedded into government policy. And what he was trying to achieve for Greensill was a position whereby they would have access to the whole NHS workforce payroll and offer them a financial product which would allow them to give control of their wages to Greensill, and they could be paid on a daily basis. And the excuse that they use the pandemic as cover to try and introduce this, because these benevolent financiers wanted to help nurses get over the hardship of cash flow problems. Well, another way of doing that would have given them a decent pay rise. So there is a gross conflict of interest. There isn't a mechanism that blocks public servants from becoming privately paid by institutions that benefited from their policies. And somebody who's cast a very long shadow over the NHS, you mentioned Simon Stevens, his history goes back further. He used to be a Labour councillor in the late 1990s. He was headhunted and fast-tracked on the NHS management scheme. He was an advisor to Blair and Alan Milburn. He helped push forward the PFI policy we talked about earlier. After 4 years of advising Tony Blair, he went off to United Health. Before he went off to United Health, he got into trouble for advocating for United Health while he was still a public servant, or within the window where they allow that people shouldn't be lobbying for anybody else, right? And then he went on to United Health, where he spent a decade. Now, his final position when he left United Health and joined the NHS in 2014, his final position was president for global expansion for an American insurance company. Now, guess what's been happening ever since he came back to the NHS? We've been molding the system behind the scenes to look like the American insurance-dominated system. He produced 2 policy papers, the 5-year forward view in 2014 and the NHS long-term plan. Now, if you just read the summary, the forward, you would think this guy loves the NHS, he worships an Aaron Bevan, but if you're as geeky and anarchy and your blood is boiling as much as mine is, you may read the whole document. And the whole document, although it's coded and very dry and very repetitive, spells out how we're going to drift into the American system, how investment opportunities are going to be provided to external providers, how staff will be made to be working outside of their competence. Yeah. So this is about profit maximization. And what we have now, after 7 years of Simon Stevens' work, he hasn't left the NHS completely, because he's been elevated to the House of Lords, where I put it to you, he'll be in charge of making sure that the Health and Care Bill 2021 will go through as smoothly as possible, especially if he can bend the ear of any Lords who might be having any doubts.
Well, so what you see is this process of managed decline and privatization couched in the language of quote unquote efficiency and empowering the front line. What are the best ways that we have to pierce through these disingenuous arguments put forward for a purpose?
Well, they have provided us with a good test case, the pandemic. Those services that were outsourced and privatized have been a catastrophic and expensive failure, like test and trace. Those elements that were run by the public sector, the immunization program, the development of the vaccine, largely publicly funded, those have been a relative success. So, the Public Accounts Committee in Parliament said that the test and trace system, which had already spent 22 billion and is set to spend 37 billion, these are eye-watering numbers, failed to deliver its prime objective. And the prime objective, the excuse for spending this exorbitant amount of money, was to prevent lockdown. Well, it failed to prevent any lockdown. It failed to have any impact on the spread of the virus. Now, that's the private sector efficiency that I would like to highlight to everybody who is still falling for this lie. There is no health system in the world that delivers comprehensive care to every member of the population that isn't publicly run. It does not exist. The American system, the most privatized system, runs away from the sick, and the state has to step in to provide them cover. If the market was so beautifully efficient, why is the American system costing double and having worse outcomes? Lower life expectancy, higher infant mortality, higher maternal mortality, and one of the worst death rates from the pandemic. Why is that? Because what they're efficient at is elevating their share price and very efficient at paying their executives tens of millions of dollars. That's what they're efficient at. And they're efficient at peddling lies.
Bob Gill, thank you so much for joining us. It's been great to talk with you. Please watch Bob's fantastic film. Stay in contact with what he does. Follow him online and on Twitter. Until next time, this is Lowkey at the Watchdog. Thank you very much.